I'm going to talk in particular about two organisations in my Hazel Grove constituency who have contacted me on the subject we're debating this afternoon. Now, for context, we know that small businesses have had a very tough time for a number of years. They've been struggling with rising energy prices, with interest rates and input costs going up. They were absolutely hammered by the previous Conservative government, which broke its promise to reform business rates, trapped them under a mountain of red tape and made it much harder and more expensive to trade internationally. And making things harder for small businesses and their workers just isn't right. They're the lifeblood of our economy and exactly where we should be looking for the growth we all need. But when we're talking about small businesses, we are of course also talking about community pharmacies, about hospices and about GP practices, all of whom will be impacted by this tax rise. We on the Liberal Democrat benches are particularly worried, as you would imagine, about the impact of these tax rises on our health and social care sector. We're worried about what this means for social care providers, for the families who depend on them, and for the local councils who have to find the funding for many of them. Now, raising the employment allowance will shield only the very smallest, leaving thousands upon thousands of small organisations still negatively affected. And in his opening remarks, the Chief Secretary asked for ideas about where else he might find some tax revenue. And I'd really encourage him, and indeed members on all the government benches, to reread the 2024 Lib Dem manifesto, as I'm sure they've read it at least once. And as the Honourable Member for St Albans laid out from our front bench, they could reverse the tax cuts that the last government gave to the big banks. They could reform capital gains tax so that it's applied in a much fairer way, and they could charge the gambling giants more so that they pay their fair share. So, on to the two organisations in my constituency, Madam Deputy Speaker. A childcare company got in touch because, like many early years settings, they allocate 70% of their revenue to staff wages, and annual increases to national living wage combined with this increase in NICs will just make it impossible to pay for rent, staff improvement and training. This is just going to make the staffing crisis worse, and that is the exact opposite of what this government says it wants. I will give way.
I'm very grateful to my Honourable Friend for giving way. Would she agree that businesses like Sheppey's Cider Farm in Taunton Wellington constituency, to which I invite all members to come and enjoy a pint of cider, will be affected not just by national insurance rises, but by the change in business rates and the family farm tax as well?
Lisa Smart.
Well, I thank the honourable gentleman for his intervention, and I sadly have not yet tried the wares of Sheppey's Cider Farm, but I would welcome the opportunity to visit and to try their wares and to support them, as we all need to do in the face of these changes impacting them all. The second organisation, Madam Deputy Speaker, that I want to raise in the chamber today is one of my GP practices. And they emailed because, of course, they operate as a legal partnership, and they have done since the inception of the NHS. But as a GP practice, they lack the flexibility to absorb these increased costs. They can't raise prices, they can't do more than they're already doing and drive up activity levels. Because they're designated a public authority, but they're not exempt from this, they don't get an employment allowance exemption. So they're going to bear the absolute full cost of the impact of this. And they tell me this rise in national insurance and the lowering of the thresholds is going to force reductions in clinical staffing, adversely impact patient care and increase waiting times. This is exactly the opposite of what the government says it wants. I will give way.
Thank the Honourable Member for making that point. It's very powerfully put. In my constituency, speaking to a local GP surgery, they're going to have to cut 7 members of staff. That's a GP, a nurse, a social prescriber and a pharmacist and a number of other ancillary services. That is going to affect not just her and my constituents, but every single constituency in the country, because every single GP practice will have the same problem.
Yeah, very good.
I thank the honourable member very much for his intervention. I completely agree with the point he's making. I think all members across this House want to see our NHS thrive. They want to see the healthcare and the social care, indeed, that our constituents deserve. And I urge the government to think again about its plans.
Would the right honourable friend give way?
I will give way to my honourable friend.
Victoria Collins.
I'd like to reiterate on that point. In Harpenden, Berkhamsted, we have the Elms Medical Practice, which has said we are dedicated to NHS. They want to serve people, but actually they're facing these difficulties. And it's actually asking the government to really rethink their choice on this national insurance, because it's about those who want to serve and our constituents who need it.
Mr. Smart.
Yeah, I very much agree with my honourable friend on the point that she's making. I think all of us in this House will have had constituents and organisations contact us because they're really worried about the impact that these changes will have. I don't think the government intentionally set out to make life more difficult for GPs. I don't think the government intentionally set out with its budget to make life more difficult for pharmacies, for hospices, for dental practices. But I do think we need to speak up for our constituents who contact us to say that if the government wants to keep the cost of childcare from rising, if the government wants our constituents to be able to access a GP appointment in a timely manner, they need to think again about this rise, and I urge the government to do so.
Okay.